Hi, I'm back. This time, I want to talk to you about something a little bit different. How about you as the caregiver? So, you're providing care and nurturing to a family loved one, a partner, um, maybe even a grandparent, maybe a neighbor, a good friend, a family member. Providing care, if you're the only one full time in there, is exhausting. And I'll tell you, I did a little bit of it years ago when my firstborn was a wee child, a baby, and she was diagnosed with Tay Sachs. She didn't do anything on her own. When she was unable to eat and she was tube fed, she was then admitted in the hospital. I did not provide needles or tubes or her feeding. That was done by the hospital. But I do know when you have an aged partner or close family member, it's exhausting. It takes everything out of you physically, mentally. You are tired. It's nonstop. In most cases, depending on how far the disease is or the mental illness, it it doesn't stop. You are 24/7. If you're lucky to have a support where somebody comes in, either you hire it or the government provides, like healthcare will provide a short-term um, person to come in while you do errands and take a break. But it's vital. It's very important that you remember self-care. Another very important point I cannot stress enough to you, the caregiver, and that is if your loved one, partner, parent, grandparent, grown adult child demands your attention, demands your ability to wait on them hand and foot. If they have dementia, Parkinson's, Alzheimer's, so it affects their memory, they don't know you're a loved one. They don't know who you are. The the biggest heartbreak is they don't know the connection you as the caregiver have towards the patient. So you can endure hardship. You can endure mental abuse. You also can endure thankless. The ability by the patient or your loved one that does not know who you are can be angry. They can be cruel. They can be harsh. And you take the blunt of it. Unfortunately, you take the blunt of it. I I know from very little bit of providing care to my partner who is much older than I am, not diagnosed with anything. We haven't been together more than 5.5 years. Before we became partners and I moved in here, I did not know there was any issues with a memory, and it's difficult. It's very difficult because they're demanding. They can demand something now and do it now. When they forget something you've told them and you have to repeat it over and over and over, and you're trying to have patience, it's very hard to have patience because anything I do, did, plan to do is never right. It's never done to their satisfaction. And you get tired of hearing negative, harsh criticism, reminders of you should know by now what I like. You also can hurt yourself mentally, psychologically, and physically by lifting and moving them. So be careful. Be very careful. And no, don't allow guilt to come into your mind and tell you this is your responsibility. Your responsibility is to do the best you can with what you have, do the best you can with what you know, do the best you can within your capabilities. Now, in saying that, another thought that has come to mind is a mother, a young or middle aged mother with a sick child, a busy child, a child that does not sleep. That too is exhausting. Mentally, physically, it's exhausting. Spiritually, it breaks you down. A grown adult can be harsh compared to a small child. A small child is forgiving, unconditionally loves you, and shows that. It's very rare as a caregiver to dementia, Alzheimer's, Parkinson's, any mental illness, disease that you are subjected to. It's exhausting because you don't hear kind words. It's rare to hear kind words. In the worst case scenario, there's anger and violence. It isn't the patient's ability to know what they're doing. So, medication is vital. But it's not uncommon for you as a caregiver to feel like you've you're depressed. And that's because you need self-care. You need to take a break. Get out of the environment of the person you're taking care of, especially when it's family. Be good to yourself. If you are committed to taking care of this loved one, you need to take care of you first and the patient second, because if you are not well, you cannot provide loving, caring care. So remember, part one, providing care as a caregiver to a loved one. Stay tuned. I want to talk more about this. Part two in a day or two. Thank you for your time. Bye for now.